Hello guys, welcome to Homeo Health Care. Today we are going to discuss on the topic of osteoarthritis. So, what is it? Osteoarthritis is the one of the disease of degenerative joint disease where in which joint it gets affected the degenerative changes can be seen. The another term for it is osteoarthrosis and it is a wear and tear of joint. It is a clinical condition that has been encountered in the clinical practice. What about its type? Mainly, it is of two types. That is primary osteoarthritis and secondary osteoarthritis. Firstly, we will see what is primary osteoarthritis. It is a condition where firstly no pathology was present and now this degenerative changes has been seen. The joint has been affected and it is the most common condition than the secondary osteoarthritis. So, which is the common site where the primary osteoarthritis is seen? It is seen in weight bearing joints like hip joint, knee joint. Here it can be seen. Then, what about secondary osteoarthritis? In secondary osteoarthritis, firstly, the primary disease will be present in that joint. And after that, the degeneration or degenerative changes will be seen there in further many years also after having the primary disease in that joint. That is secondary osteoarthritis. And hip joint is the most common site where it can be seen. What about its pathology? So, firstly, if it has been affected in the knee, what changes will be seen? The fluid present in that joint will get increased. In knee joint, there will be the synovial fluid. So, synovial fluid content will get increased with the depletion of proteoglycans that are present in the cartilage matrix. So, now this depletion has been there. And when the repeated weight bearing condition comes to this joint, when there is depletion of proteoglycans and increase in the synovial fluid, at that time it leads to the fibrillation. And after this fibrillation, there will be abrasion by the grinding mechanism. With the help of this grinding mechanism, the abrasion process takes place. And the underlying bone behind that cartilage will get exposed. After getting exposed of the bone, which was underlaid by the cartilage, there will be the hypertrophy of that bone. Means the bone cells size will get increased than the normal here, which leads to the formation of the spurs, and that spurs are known as osteophyte. And the capsule of the joint also gets affected. There will be the thickness over that capsule, and due to this thickness, there will be the deformity of joint with the stiffness. These are the pathological changes in the osteoarthritis of the knee. Now, what clinical features you are going to see here? First and mostly, we will discuss about onset. It will be insidious, gradual onset. This degenerative condition develops slowly in the patient. Initially, the course is intermittent. Sometimes patient experiences the pain, sometimes don't in the initial stages. And the type of pain is localized. When it gets aggravated, when the joint gets used. So, when does this knee joint get used? At the time of walking, climbing stairs. That will be the aggravating modality. Then, by which thing this patient gets relief from the pain? When he rests, you rest that joint. That means amelioration by pressure. And as the disease progresses, this condition becomes permanent. The pain will be permanent. And mostly, this pain is nocturnal pain. That means in the night, pain gets aggravated. It will disturb the sleep of that patient. And morning stiffness will be there. And this stiffness can be present in the patient in the morning for 15 minutes. What examination findings you will see in such patients? When a physician examines the knee, there will be the local tenderness. Joint will be irregular. The reason behind that is the osteophyte formation. Crepitus will be present on moving that joint. At the time of examination, when the physician moves the joint, he may feel the crepitus. So, this can be the examination findings of the osteoarthritis knee. What about its investigations? X-ray. In X-ray, what changes will be present? There will be the space reduction of the joint. That means the space between the two bones which forms the joint will get reduced. And mostly on the medial side, not on the lateral. Medial side, medial joint space reduction. And if this finding comes in the X-ray, it indicates the joint has become unstable. That is instability of the joint. Further, osteophytes formation are also there. And there will be the lateral shift of the patellar space. These changes will be present in the X-ray. What about MRI? In MRI, it will show the degradation, degeneration of the cartilage. Cartilage tissues will get degenerated, due to which the bones underlying that will get exposed. This thing in the MRI will be seen. What are the radiological grades for the osteoarthritis? Grade 0, grade 1, grade 2, grade 3, grade 4. In grade 0, the radiological findings absolutely normal. But when it comes to the grade 1, there will be the possibility of formation of osteophytic slipping. That means the osteophytes has been not formed yet and can be little joint space reduced, and lipping of osteophytic changes will be there. That means structural changes has not taken place yet. That means the SORA with the formation of psychosis, osteophyte slipping can be there. In grade 2, there will be the osteophytes formation and possibility of joint space reduction. That means the psychosis miasm gets developed as the structural changes will be seen in SORA and psychosis. So it is outgrowth means SORA, destruction, syphilis. That's why the psychosis miasm gets stronger. Now, in grade 4, there will be multiple joint space reduction. Before going to grade 4, we will see what about grade 4. Joint space reduction, osteophytes formation will be there. That means strongless psychotic miasm. And when it comes to the grade 3, there is multiple osteophytes formation. That means more and more psychosis miasm is present. And in grade 4, with these osteophytes, there will be the deformity of joint. The joint gets deformed. Deformity means destruction has also seen. Means psychosis and syphilis both are present. That means it has changed into the psychosyphilitic state at that time. What about its treatment part? In homeopathy, after taking a case and going through that case processing analysis, what remedy comes up for the patient after administering that medicine, and in the particular course of treatment, he will get relief from his suffering. जब कोई ऑस्टियोआर्थराइटिस का पेशेंट आता है, उसकी डिटेल केस ली जाती है, बाद में कौन सी उसके लिए दवा ऊपर निकल के आ सकती है, जो देने के बाद उसे अच्छे से आराम मिले एक कोर्स ऑफ ट्रीटमेंट में। फिर जब जो ऑस्टियोआर्थराइटिस का पेन होता है, वो पेन बहुत कम हो जाता है, उसको उतना तकलीफ नहीं देगा। जेव्हा एखादा व्यक्ती, एखादा पेशंट त्याला ऑस्टियोआर्थराइटिस होतो गुडघ्यांचा, त्याची जेव्हा केस घेतली जाते, केस घेतल्यानंतर त्याच्यावर कोणतं औषध निघून येतं, जे औषध त्याला चांगल्याने लागेल आणि त्यानंतर त्याला आराम पडेल, एका ट्रीटमेंटचा जो कालावधी असतो त्यामध्ये, त्याच्यानंतर त्याला जितका त्रास होतो पेशंटला ट्रीटमेंटच्या आधी, तेवढा त्रास त्याला राहत नाही. As we says, we treat the man in disease, not the only disease in the man. आजारात आलेल्या व्यक्तीसाठी औषध देण्यात येतं, rather than फक्त त्याच्या आजारावर औषध देण्याऐवजी. If you like this video, subscribe to my channel. Thank you.